I am one of the admissions team nurses, and I am often the first nurse that our patients meet.
I've been with hospice for 22 years as a volunteer.
I have worked for the Center for Hospice for 11 years, but with the past 3 years I've also gotten my certification.
So now I've probably it's been over 12 years I've been connected with hospice as a volunteer.
I'm the Director of Support Services.
I'm a volunteer.
In the 70s, the hospice concept began to surface, and there was discussion in the community.
There was a committee of physicians and nurses and people who were interested in the health care of the community.
People in the community rallied immediately around the concept, but it still was a slow growth.
I was happy to hear about it because I looked upon it as a real step forward for the cancer patient.
All of the hospitals really did something to support our hospice being in existence.
Getting Junior League involved in the very beginning with funding, and I believe it was 30 volunteers that jumped on board to really beef up our financial situation and the volunteer situation.
Our budget at that time was less than $1 million.
Oh, when I came we had maybe 5, 6 patients, and we really thought we were really big stuff. When we got 15 patients, well, it was like, wow.
And just the number of lives and the number of people that we continue to touch every year grows and grows.
One way or another, the hospice movement has touched probably everyone in the community, either through helping care for their parents or a friend, a family member. And the organization has a long enough history in the community that, you know, you've heard about it now and again.
I've seen people who are very afraid become peaceful, become settled. You know, can't always change the circumstances, unfortunately, but I've seen them be able to accept and to have quality. Every day is a quality day then.
And the concept is to make those days as meaningful as possible and especially comfortable, and to keep the patient at home. If at all possible, we now have a hospice house for those situations where it just can't be done at home anymore.
For in hospice house, for one, we let them know they can come in 24 hours a day. That's a great relief right there. We also let them know they can call on the phone 24 hours a day. They know that they have a connection right there.
And there's no other alternative out there that can lend you the support that you would need during this period of time.
Death touches all of us, and I think, you know, that brings out a certain wonderment too about the whole death and dying process. It certainly is a time when people are very vulnerable. It's also a very painful time. It is also a time that can be a very rewarding time. Some of our patients say that it's the most growthful time of their life, even though they're coming to the end of their life.
Hospice is not about dying, it's about living and the quality of life. And palliative care is pain control. It's not having you numbed out, and it allows you and your family to sustain your life for as long as possible in a quality way.
Our volunteers are so great. I mean, we can call them on the phone because we've run into a real crunch or we have a problem.
One man in hospice house, when he put on his call light and went in there, and he said, "I just want you to sit here."
Every aspect of our programs at hospice utilize volunteers in one way or the other. And they're people from the community who are just a wonderful, wonderful asset to our program, and hospice would not be hospice without the volunteers.
These are people with a purpose, people who are dedicated. And it's not just they're here for any type of glory, if there is glory. They're here to serve.
Somebody asked me what I do, I'm a volunteer. That's what I am. And if we had to go out and pay for all the volunteer services that we have, there'd be no way we'd be able to kind of give the good return on a donation or an investment that people get from us.
I'm very proud of our hospice. I think it really is one of the best in the country, and the focus is definitely on the patient.
I am just very grateful to have the opportunity to help people in a situation that might seem helpless to them.
It seemed like it's just changed my life on the way I think of people and deal with people. I'm not mellower now, and I am more compassionate for people. And like I said, my listening skills have gotten so much better.
So I take more from the job, I think, than I give it.
Just to be there, and if they cry, and sometimes we cry too, you know.
What the dying teach us is how to live.
The impact, the care, the easing of the suffering that hospice does for patients and their families is just a fine reward for all who are associated with it.
After a while, it becomes part of you. You know, I really feel that it's part of me and I'm part of it. But it being hospice, I look forward to the meetings that I attend. I look forward to meeting with the people. I look forward, I take pride in the growth and the accomplishments of this hospice. I have an interest, I have a vested interest. This is my stake in the community.
What's in it for me is what's in it for the community and for the places that we live. And I'm very sincere about that. That's why I volunteer. I want to give back a little bit of what was given back to us.
Something like hospice doesn't flourish unless there's a need. And the community sees a need, fulfills that need, and its need in this community was served by this hospice. You couldn't do for yourself and your community any greater good.